Thank you for the opportunity to present our study evaluating the safety and efficacy of photobiomodulation on symptoms of an overactive bladder. We have nothing to declare. Low-level light is capable of modulating biological processes through the photoacceptor molecules of hemoglobin, myoglobin, and cytochrome C oxidase. Near-infrared laser light initiates cell signaling pathways, and some of the changes that you see are increased membrane stability, increased resistance to depolarization, and reduced neuronal excitability. Symptoms of neural dysregulation appear to cluster in patients who have frequent overactive bladder with or without nocturia. We therefore hypothesize that near-infrared laser light delivered to the underside of the brain for transfer across the pons may stabilise autonomic regulation of the descending neural pathways in overactive bladder patients, having a neuromodulating effect. The aim of this study was then to test the safety and efficacy of near-infrared light delivered close to the Pontine Micturition Centre via a nasal probe for patients with overactive bladder. We wish to establish the safety of this, to quantify any immediate effects, and to understand the safety when multiple doses were applied, and to know whether this reduced the severity of symptoms. The study occurred in two parts: an observational study during urodynamic filling and a proof of concept study. Patients who were attending for urodynamic investigation for Detrusor overactivity wore the near-infrared laser light during the second fill. Now, this is a non-laser light emitting diode, non-thermal, non-destructive, and it was applied for the short duration of the second urodynamic fill, while we looked for safety impacts on blood pressure in particular. We also looked for any direction of change in the urodynamic measures between first and second fill. The second part of the study was a single case experimental design where measures were made repeatedly over the run-in month, during the application month, and the follow-up month. The primary endpoints for this were change in overactive symptom score, change in urinary frequency, change in OAB quality of life measure, and any adverse events. As you can see here from the graphs, there was no change in either systolic or diastolic blood pressure during the second fill, indicating that the near-infrared light delivered via the nasal cavity was safe. There were no reports of adverse events. The application was very short, and we didn't see any significant changes in urodynamic parameters. The participants for the Part 2 study numbered 4. You can run a repeated measure study between 4 and 6, and this study was stopped because of COVID. We had 2 males and 2 females, and as you could see, they were very comorbid. What we have here is the change in overactive bladder score over the 12 weeks, the run-in, the active phase, and the follow-up. And you can see that 1 out of 4 participants significantly reduced their overactive bladder symptom score. And the tau-U statistics that are performed on this type of study showed that participant 3 maintained this during follow-up. Here we have the results of the quality of life measures, and in 3 out of 4 patients there was an improvement after the 1 month using the near-infrared laser light, and in 3 people this was maintained 1 month later. Most importantly, near-infrared laser light was not associated with any adverse effects in the patients with OAB. We believe that applying it via the nostril is safe, and it has the potential to reduce overactive bladder symptoms and perhaps urinary frequency. Certainly, the quality of life improved in patients who used the near-infrared laser light, and 1 in 4 of these patients had a significant benefit, and the others had symptom reduction. In terms of where this work will lead, participant 3 had multiple sclerosis and a very sensitive nervous system, so we believe that its trial in neurogenic patients is probably warranted. We also understand that the patients we treated were not treatment naive, and had quite severe symptoms, so there may well be scope to try this in patients with less severity of symptoms. Thank you very much for your attention.